So a couple of you have already touched on home care workers, and so we appreciate that you've done that, Jane and Angela. Home care workers are really the unsung heroes in our society, really propping up communities, providing necessary supports and services so that people can remain safely and independently in their homes and live in community versus institutions. As we know, seniors and adults with disabilities make up 25% of San Franciscans, and that number is expected to increase. What would you do as mayor to address the workforce crisis that we're currently seeing, the shortage of health and long-term care workers? What would you do as mayor to address this workforce crisis? And I'll start with Mark. Mark.
Through the 10-year experience of sharing my mother's Alzheimer's before she died 5 years ago, I got to know firsthand the extraordinary value and the extraordinary uncommon kind of person who does home care work. My mother had a caregiver who gave so much of herself, and this was all in the state of Florida, where there were very few legal protections for that worker's wages or for benefits and work conditions. Here in California, we do somewhat better, and I was pleased in Sacramento to co-author a bill that prohibited 24-hour shifts, that it's now 8-hour shifts, and that, of course, is not only good for the worker, but also good for the receiver of the care, because no one can do a job reasonably without any kind of breaks, and of course on a poverty salary. So we need to focus on career ladders for home care workers. Home Bridge, has a career ladder program, which I think we can learn from and build upon so that there is advancement in the work and that there can be a career path. Also, there's consideration, I understand, at the community needs assessment process that is looking at tiered wages as well. Some incentives, not only for wages, but also for the working conditions of our home care workers. They are doing the Lord's work. We need to be there to support them. Free muni for these workers is a possibility. Other benefits that we can offer.
Thank you. London, same question. About the home care worker shortage.
Me?
Yes. Oh. I'm sorry, I didn't know if you
I'm sorry. Can you say the last part of the question, because I can hardly hear.
Absolutely. Are you having trouble hearing me?
A little bit.
A little bit? Okay. Sorry about that. We are facing a workforce crisis in health and long-term service providers. What would you do as mayor to address that crisis?
Thank you. And you know, my experience with working with in-home support services workers is, of course, again, with my grandmother. And fortunately, you know, I had an amazing person who worked really hard to take care of her. She knew me growing up, and you know, she treated my grandmother like she was her family. And it is backbreaking work, just to give her a bath and the number of things that we had to do. I mean, you know, I've had challenges doing it when I used to also help take care of my grandmother, and I think about, at that time, less than $10 an hour, what Gloria was actually making to help support my grandmother. You know, it was heartbreaking. She was extremely low income, and she definitely deserved more. And I truly believe that, you know, our healthcare workers deserve to be paid a lot more than they are getting paid. And one of the things that is being discussed now at the Board of Supervisors is the minimum compensation ordinance, which increases, on top of the increase for the minimum wage to $15 an hour, it increases the hourly wage of in-home support services workers to $1.86. But there's just so much more that we have to do to make sure that we support this population, and I think that we need to come up with a long-term plan to gradually increase those wages so that they are, you know, decent middle-income wages, and I will focus on doing that as mayor. And
Thank you.
Thank you.
Thank you very much. Angela, same question, and then Jane. Angela.
Again, I have been working with people with disabilities and in-home care for years of my life, whether they're formerly homeless people or whether they're just in the system and having health care needs. I was endorsed by the new United Healthcare Workers because of all of our work when I was president of the Board of Supervisors and after. I have not stopped working for healthcare workers because I think they're the most underpaid. But I'll tell you what I think the worst situation is for them in San Francisco. They don't have a place to live. There's no affordable housing for healthcare workers. We need to specifically get housing for healthcare workers so that they're not traveling for an hour to get where they have to go, which is extremely expensive. They're not in this unbelievable traffic that has been created in San Francisco, and they're not with the person they're supposed to be taking care of. It's too many hassles. And so there's a new program in San Jose that I absolutely love, where they did a housing unit of over 400 units. Well, it might be about 380 because they used other units for retail on the bottom, that is specifically for the nurses that work at the hospital 3 blocks away, and the rent is dependent upon their salary. So some nurses that make more money pay more rent, and those that made less money paid less rent. So people that make $40,000, $50,000, $60,000, $70,000, which is not considered affordable in San Francisco, are given a rent that is based on their salary so they can be near the hospital.
Thank you.
We need to do more programs like that.
Thank you. Jane. Thank you.
I'm the co-author of the minimum compensation ordinance, which would give a raise to our IHS workers, and also the author of Proposition C, which will generate $19 million to help fund this pay increase for IHS workers. I really believe that we just simply need to pay our home care workers more, whether you are a child care worker to an in-home support services worker, you are making poverty wages to do some of the most important work. And I think as we look to the future of work and the future of industries, this is the industry that is going to be growing. So we need to invest public dollars to make these real living wage jobs so that people can afford to do this full time and actually serve a very important need in all of our communities, whether it is serving our youngest residents to our oldest residents. But I think we simply must lift the wages and the benefits. I'm happy to support and vote for MCO when it finally comes before the Board of Supervisors. This will only be the beginning, as we need to continue to continually raise these wages.
Thank you.